tough act to follow, hey? I would like to follow on actually from Roger, and particularly with reference to the part on his timeline that suggested a whole bunch of stuff that you don't really want to do anymore, by saying that I'm actually an obstetrician gynecologist, and I absolutely think it is the most amazing job in the whole universe, and I feel really, really lucky on a daily basis to be able to do what I do. So what I'm hoping to do for you guys today is to go through a little bit of a history, and I don't really have any cute props, and in fact, aside from not having cute props, I've got a little bit of graphic imagery here, so please don't be too afraid. If you all turn around, I'll know to flick on to the next slide. So we're just going to go through what happened back in the 1800s with women having birth, and how the changes from the 1800s to where we are today kind of really dictates not just about the process of going to have a baby, but also speaks a lot about feminism and speaks a lot about the empowerment of women throughout the centuries. So going back to the 1800s, 1900s, this was the domain of women-led birth. Women were women carers. Less than 5% of births actually happened in a hospital. Having said that, it wasn't particularly safe and it wasn't particularly comfortable. And in fact, the primary textbook referencing pain relief for women quoted to have a towel attached to the end of the bed because pulling on this would draw great comfort for the woman. Clearly written by someone who's never been through labour or seen anyone going through labour. Towels don't really help. The other thing about the 1800s to 1900s was there was a great emergence about the understanding of infection and how infection could be really dangerous for women and in particular for newborn infants. And so they had this philosophy about infection and were implementing some strategies that perhaps weren't exactly successful. And again, this same textbook that referenced the towels had suggested that women should have their genitalia hair cut short, and then the area should be scrubbed with a sterile solution and then prepped with bichloride. So basically what they've suggested is you're shaved, you're scalded, and then you're sprayed down with acid. Now you're really ready for labour. As far as pain relief, aside from the towel theory goes, there certainly also was an emergence of ether, which is an anaesthetic first actually documented by use by Queen Victoria in the mid-1800s. Unfortunately, ether is an anaesthetic agent not really used so much today, but does actually knock the woman out for 6, and does cross the placenta and unfortunately stops the babies from breathing frequently. So it wasn't such a great addition to the pain relief repertoire of the time. So pain is a feature of labour, and it wasn't until 1914 when this article was published looking at the painless childbirth, which really promises so much for women of the time. And in fact, this idea of twilight sleep, which is what it was called, sounds pretty great. Painless childbirth after having a towel as your only option doesn't sound too bad at all. Unfortunately, the painless childbirth wasn't quite so much. So the means of obtaining pain relief was by giving morphine, which is a very strong pain relief agent, something like heroin, and another dose of a drug called scopolamine, which is an amnesic agent. And an amnesic agent is one that makes you forget, basically. So you're given heroin and then something to forget everything that is going on. Unsurprisingly, women actually thrashed about quite seriously during all of this. They forget everything that happens. They didn't realise that they were so dangerous and so uncontrolled. And so as a result, the general method of being able to control women at that stage was the 4-point leather harness. So women were actually strapped to the bed to stop them from being able to flail and hurt themselves, ostensibly, but more likely anyone else in their path during the course of the throes of labour. Not exactly the scenes that evoke the nice candlelit childbirth that we hear about now. Along with this time came a phenomena by Dr. Joseph Daly, who, I'm a little ashamed to say, was a bit of a pioneer in the world of obstetrics, and published a textbook shortly after painless childbirth, advocating for maximum obstetric intervention for all pregnancies and all births. So as soon as the woman arrives in hospital, she is to be treated as though birth is a pathologic or disease-laden project. It's not a physiological process that is natural or normal. This is something that is a disease and should be managed as such. Therefore, everyone should be receiving their anaesthetic of the twilight sleep, much nicer than what it sounds, and they should be given an episiotomy, which is a cut on the vagina to increase the space of the vagina, and they should be having forceps delivery in order to be able to deliver their baby, because if we increase medical intervention, everyone's going to have better outcomes. It doesn't even sound good when you hear it. I'm not quite sure how that flew for so long. Unsurprisingly, despite the fact that this was actually with the best of intentions that this concept was implemented, it wouldn't surprise many of you to know that there were increases in the birth trauma associated with the increased instrumentals to a tune of about 40% for fetal injuries between 1913 and 1930 with this practice. And some of these images are really quite graphic, but they certainly give the impression of a mother not wholly involved or wholly empowered in her birth at all. So it wasn't really until the early 1940s that we started seeing an appropriate fall in risks to both the mother and the baby associated with childbirth. And up until the mid-1930s, childbirth was actually a truly dangerous thing to do. By that we mean 40 women out of every 1,000 women to deliver would die during childbirth, and 70 babies out of every 1,000 babies born would die during childbirth. Amazing statistics. And to put it in the context of even our local area, the Gold Coast Public Hospital delivers around 5,000 women per year. So that would mean 200 women each year would die, and in the order of 350 babies would die each year just in our small service on the Gold Coast. Phenomenal statistics, given that it has been several years since we've seen a maternal death here. So these dramatic reductions of maternal and fetal problems, morbidity and mortality, weren't just associated with Dr. Joseph Dalee's ideas being thrown out the window. Obviously, the advent of antibiotics like penicillin really made a huge difference to something that we call puerperal sepsis, which is essentially an infection associated with pregnancy. But also the availability of blood banks and being able to give women blood to treat obstetric hemorrhage made a huge difference. Safer surgical techniques and certainly safer anaesthetic techniques than the old twilight sleep were also very helpful in being able to improve outcomes for mothers and for their babies. So we got really good at making birth a lot safer than it was certainly in the 1900s, in the 1800s and early 1900s. So much so that by the 1950s, sort of the routine maternity care that was originally designed to improve safety had almost gone too far. So on arriving to the hospital for their labour, women were ushered off to a separate room, given a shower and a nice cleansing enema to start their labour, because infection is bad, and so keeping things as clean as possible is a good idea. Husbands were infection risk, so they were shuffled off to the other room. They weren't seen again until after the baby was born and the baby was in the nursery, and the woman had had a chance to freshen up and put on a little bit more lippy. The babies themselves were actually separated from the mums, and this is a really different phenomenon from what we're seeing today. So as soon as the babies were born, they were taken off to the nursery, and they were minimally handled, because the idea that the more you handle a baby, the increased risk of infection seems totally unnatural to us. And when you see this baby, everybody yearns in the audience. Everyone wanted to come up and pick up you don't even know this baby. So for your own baby, you can imagine that power is even stronger. So to keep the baby in the nursery is a strange phenomenon, and even stranger was the idea that the crying was really good for the babies. So you don't want to touch them because that actually is going to increase their risk of infection, but it's really good that they're having a good bawl because that's opening their lungs up a little bit. The other thing that's quite different is that breastfeeding was considered to be an infectious risk and quite dirty as well, such that bottle feeding was thought to be the sterile and safe way to deliver food to a baby. And as such, most of these babies were not handled by their mother at all for the first week and fed exclusively by the nurses in the nursery, as you can see there, by bottle, by which time the mother's breast milk will have been dried up. Breastfeeding was essentially isolated to women who couldn't afford formula, an entirely different concept from what we're seeing now. Bring on the 70s, hey? So the 70s brought with it a whole women's liberation movement. We saw women's health change. We saw the childbirth reform of the 1970s that went along with all of the other naturalistic ideals of the 70s. It really challenged this male medical dominance in the women's health and really brought the locus of power back to women for childbirth and for pregnancy and for raising children as well. There are a whole series of fabulous childbirth books that were published in this time, with my favourite of which being called The Orgasmic Birth. Read it, not quite sure if it's possible. Nonetheless, by this stage, birth is actually quite a safe phenomenon. We've gotten much better with regards to pain relief. We've got gas, we've got safe epidurals, if you want them, although the concept of natural birth after this 50s movement of pushing on everything as medicalised as it could be has come really into favour. We're really wanting to minimise intervention. Even though the 70s doesn't seem to me like it was that far, probably to you guys it's like the dark ages, but to the 70s wasn't that long ago, and yet home pregnancy tests weren't available. Most people had to wait a couple of months and then they'd go to their doctor for a pelvic examination to find out if they were pregnant or not. And most importantly, and most different from where we are today, ultrasounds weren't available. So these images you won't see ever today. So these are X-ray images of a baby inside its mum's tummy, and you can see in the big picture that the head is in the pelvis. You can kind of get an impression for that for those with a good eye. So these were utilised in order to be able to assess fetal maturity. Can anyone pick it? We've got a head, we've got a spine. This is a baby spine here, mummy spine. These things don't get seen today, but this was assessed to look at fetal maturity because really sometimes babies are big, sometimes babies are small. It doesn't always mean that they're fully grown. And when you don't really know when you were truly pregnant because you don't have an ultrasound scan and you don't have a pregnancy home test to take, these were sometimes utilised to know whether someone had adequate maturity in their pregnancy in order to be able to induce the pregnancy. So quite uncommon to what we're seeing today. So ultrasounds actually were invented back in the 1950s, and there was some clinical use to them even back then. However, they weren't really taken up into routine use into the late 70s, and it wasn't even until the early 80s that they were utilised frequently in Australia at all, and the late 80s was when we started seeing regular ultrasounds being incorporated in part of our care. And you can even see, so this the first slide on the left is that of the mid-80s sort of ultrasound, and you can see those top three slides really demonstrate in just 10 years a great change in the quality of the images that we're getting. And of course these awesome 3D images that we're getting now that, to be honest, up until the last 5 years were mainly just to look cute, but in the last 5 years we've been utilising them more from a diagnostic perspective as well. Still, they're mostly fun. How cute are they? Okay, that's not the point. I don't have a real one. I have to linger on the fake ones, hey? Okay, so then that kind of brings us to today, and it is safe to say that today we're really in a position where birth is safer than it ever has been at any other time in history. We are so lucky. But do we have it all? I'm sure that many of you will have heard about the concept of the cesarean section epidemic. It makes it seem like a disease. And I guess that makes us question, is it real? Are we doing too many cesarean sections? Is this a problem? Why are we doing so many cesarean sections? So certainly we know that 20 years ago, 18% of babies, 1/8, were being born by cesarean section, and this year more like 33% of babies are being born by cesarean section. So that means that of you all here, if you're looking around at your friends, one of you is definitely going to be having a cesarean section of every 3. It may increase. Are you picking who it is? No. It may increase by the time you're all having your babies, but certainly we know that the contributing factors would include the fact that women are getting older when they're having their first baby. And in fact, 2012 was the first year that first-time mums were more than 30 years of age. So 20 years ago, a mum in her 30s was an old woman. Now, we're like really young and hot, having our babies at 30. It's okay. In fact, 1 in 5 mothers are more than 35. So there's been a huge change, and 230% increase, in fact, in women having their babies in their 40s compared to 20 years ago. There's also improvement in diagnostic ability with our ultrasound scans, so we're able to detect problems with the babies that we know would be able to be helped by a cesarean section, although that's not a lot, actually. Maternal choice is changing things, so if you're only wanting to have 1 or 2 babies, a lot of women are electing to do that later in life, and therefore cesarean section's not necessarily a bad option for that cohort. So the concept of an epidemic does sound terrible, and perhaps there is an overuse in some circles, but it probably isn't quite as dramatic as it comes across. The other fabulous thing that's happened in the last 10 years in particular is that there's been a great move back to the 1800s concept of women-centred, women-led care. So midwifery groups are very empowered and are providing fantastic women-led services that can go from the home to the hospital. In addition to that, medical students in the 1970s, there were about 9% females, and now there are at least 50% women taking on medicine, and more than that who are doing obstetrics, which I would hope would lead to more woman-focused and improved care ultimately. I think we've really been in a very privileged position where we've changed our focus from safety. So it's not just about, are we going to survive? Is our baby going to survive this process of childbirth? And it's really become about the experience. And we're really at such an empowered point of history where we can choose how to have a baby, right from having a pain-free water birth through to a maternally assisted elective cesarean section. I would really like to emphasise that whilst the experience is important, and we certainly want people to feel as though they are empowered at the end of their birth experience, that we shouldn't lose sight of the fact that safety still is the #1 priority, and we have to focus on what our endpoint is as being our target. Thank you so much, everyone.